Good evening and thanks very much for joining us. I'm Brittany Ramsey. We begin tonight with some sad news as another person has died of COVID-19 in our district, bringing the total pandemic death toll to 38. That comes as the health unit confirmed 51 new cases today. 49 come from the Thunder Bay area, 1 comes from a First Nation community, and the other from elsewhere in the district. 9 of the new infections are from the ongoing outbreak at the Walford Retirement Home, which has now had 30 cases over the past 6 days. No other details are available from the company that runs the home, but we can confirm that the majority of the cases involve residents at the Walford. That home was the site of a mass COVID vaccination back on March the 4th. Meanwhile, 14 of today's cases come from close household contact, 10 others come from close contact outside the home, and 18 of unknown exposures. The total case count for the district now sits at 2,390. 446 are still considered active. That's up from 437 on Sunday. Major moves have been made at the regional hospital after an outbreak was declared in one of its general medical units. Patients have been diverted elsewhere and elective surgeries are being postponed as the facility has put temporary measures in place to keep the system from being overwhelmed. Corey Nordstrom has more.
Friday's declaration of a COVID-19 outbreak in the 1A medical unit is being met with swift action from Thunder Bay's regional hospital. Tracing has reassured hospital officials that there is no spread of the virus outside of that unit, but there are currently 44 patients with COVID-19 in the hospital, with 11 in intensive care and 4 related to the outbreak. The facility is now in what they consider level gray or lockdown.
To date, we have redirected 5 patients from the region who typically would have come to Thunder Bay for ICU care to the east and south. We've taken 5 additional patients from our ICU and transferred them to the south. And this is all in an effort to make sure that the hospital doesn't become overwhelmed.
And upon filling their 22-bed ICU on Friday, other changes have been made to allow for more room, though it means the hospital has had to postpone non-urgent surgeries, shrinking its number of operating rooms from 11 to 6.
We have expansion plans to add 4 and then 6 and so on, and we can add more. We did, as we were working with the province on the redirection, expand beyond the walls of the ICU. So today we have a few patients who are ICU patients being managed outside of the ICU in a space near the ICU.
On Friday, 19 of the 22 patients in the ICU were on ventilators. That number is now significantly lower, and Voros offers reassurance that the hospital is nowhere near its limit on available ventilators.
We have access immediately to up to 50 ventilators, and we are able to access the provincial stockpile to go beyond that if needed. Today, we have 11 patients vented in the hospital, so we have a lot of room and ability there to manage the situation.
On the vaccine front, Voros is expecting the same number of Pfizer doses to the community this week, and there's additional shipments of the Moderna vaccine coming compared to its usual allotment. Corey Nordstrom, TVT News.
In addition to the outbreak at Thunder Bay Regional, Wilson Memorial Hospital in Marathon is in the midst of a similar situation. An outbreak was declared on Saturday when a resident in the chronic care wing tested positive for COVID. On March 9th, a hospital employee also tested positive for the virus. North of Superior Healthcare Group CEO Adam Brown says as of today, no other patients or staff have tested positive. However, more testing is required to determine the full scope of the outbreak. In the meantime, the hospital has doubled down on its infection and control procedures.
We cohort our staff, so as much as possible, we try to keep our chronic staff on the chronic ward and our acute and ER staff separated from that ward. Similarly, all of our residents inside the building are isolated to their room. Unfortunately for them, we've canceled visitation, which is also very unfortunate. So all visitation, with the exception of palliation and obstetrical care, will be canceled or has been canceled.
Brown adds the situation at Thunder Bay Regional shouldn't impact his hospital's ability to care or transfer COVID patients to Thunder Bay. However, he does note other procedures that would require care at the regional may see patients sent to locations outside of the district. Premier Doug Ford is promising to immediately iron out what he calls wrinkles with Ontario's new online booking system for COVID vaccinations. The system went into service today, and while tens of thousands of people were successful in booking an appointment, others weren't so fortunate. Colin DeMello reports.
After weeks of waiting, Ontario unveiled its online vaccine booking portal, open for those at the greatest risk of being affected by COVID-19.
If you're going to be 80 this year, if you're going to be 80 in September or October, November, please go online and book your appointment.
The moment it opened, thousands of people rushed online, and while many shared stories of success, others began experiencing issues.
I run a community home care business, and I have a client who is 93 years old, who obviously isn't very tech savvy. And I logged on around 8:30, and there was 40,000 people in line ahead of me. So I patiently waited, and when I finally got through, filled out the form, and then I got a page that said the form's been tampered with.
Pat Wallace was not alone. Screen grabs shared online showed the same error message for others, that the form had been tampered with, forcing many to call the provincial hotline instead.
And I haven't talked to anybody yet. I just called in and pressed 1 a couple of times to get through, and then just waiting on hold.
Those in the vaccine task force say system issues are to be expected.
There's going to be bumps. We know that, but it appears that the system is going to be working. It's been working for Toronto, for example, for a few days, and now it's going to expand to the rest of the province.
But the portal isn't available province-wide. 13 regions, including Toronto, York, and Ottawa, will be using the provincial system. But 16 public health units will use their own systems, created well ahead of the province, including Peel Region, Durham, and Halton. 5 regions will be using a combination. The booking site was just for those 80 and above today, but the province is hoping to move to the next age group in 15 days.
We're planning for early April, and what we will do as soon as we start to see the capacity in our pipeline greater than the number of 80-year-olds that we have to get vaccines to, we will begin calling forward that next bracket to register and book an appointment.
Ontario is planning to offer 9 million people the vaccine by June 20th.
This evening's Thunder Bay City Council meeting has been canceled. The city says it's due to a worldwide outage of Microsoft Teams. That's the video conferencing platform on which Thunder Bay's virtual meetings are held. Tonight's agenda items will now be distributed between meetings over the next 2 Mondays. Councillors were supposed to discuss planned upgrades for the conservatory and the former Dees pool site this evening. The OPP and the Fire Marshal's office continue to investigate a tragic house fire in Geraldton, which claimed the life of a 2-year-old boy. The fire leveled a home on Sear Way last Thursday night. Several adults and children did manage to escape the blaze, but the young boy could not be saved. A GoFundMe was set up to assist the family dealing with the loss of the boy named Phoenix, and it's already raised more than $17,000. The OPP's Forensic Identification Unit was brought in Friday, and a fire marshal's investigator arrived Saturday to examine the scene. Greenstone OPP say a postmortem is being conducted as part of the investigation. One man is in custody and another is in hospital with serious injuries after a stabbing this weekend. Thunder Bay police were called to a home on North Cumberland Street at around 8 o'clock Saturday night, where an altercation had taken place between the 2 men. The 36-year-old suspect has been charged with aggravated assault and appeared in bail court on Sunday. All 3 levels of government came together for an announcement today to improve underground infrastructure in 2 North Shore communities. More than $5 million will be spent on upgrades in both Red Rock and Terrace Bay, geared at wastewater and stormwater infrastructure. The mayors of each community were joined by MP Patty Hajdu and Ontario Infrastructure Minister Laurie Scott. The collaborative effort saw over $2 million provided by the feds, $1.7 million from the province, and over $600,000 and $700,000 respectively from Terrace Bay and Red Rock. The work will target water mains and manholes, among a number of other areas in Terrace Bay. Much of the money in Red Rock will go towards wastewater infrastructure and on 3 roads.
It is time to be looking forward, time to be thinking about building, time to be renewing our commitment and our work to making our communities more livable, more resilient, and more sustainable places to live and work and raise our families.
The residents of Red Rock thanks both federal and provincial governments for supporting our project to replace and rehabilitate vital water and wastewater infrastructure. These measures will improve water quality, pressure, and reliability, reduce maintenance costs, and increase the longevity of this asset.
In Terrace Bay, our particular project was started several years ago, but due to financial restraints, we weren't able to finish it. And this will allow us to finish the project.
The projects are expected to begin in April, and some could take years to complete. Meanwhile, the province has announced it's providing $1.5 million in annual funding to expand mental health and addiction services in northwestern Ontario. Today's virtual news conference was attended by Minister Greg Rickford and Minister of Health Christine Elliott. The province declared the annual funding will go towards hiring up to 6 psychiatrists and developing a system-wide response to mental health and addiction challenges in the region. A centralized service hub will also be established in Thunder Bay, where additional satellite services can grow to cover all jurisdictions in the region.
We know that children and youth in this region can experience significant challenges when it comes to their mental health. And tragically, they have the highest rate of self-harm and suicide in the province. That is why the investment that we're announcing today is so important. And we're proud to be working with communities and Indigenous health partners to build a treatment network that will support children and youth, families, and communities across northwestern Ontario in their journey to wellness.
It's expected these resources will support approximately 1,800 patients per year and reduce wait times for those services. The list of local candidates for the next provincial election continues to take shape, and there's a familiar face throwing her hat into the ring for the Progressive Conservatives. Mo Kamuzi ran for the party twice federally in Thunder Bay Rainy River, finishing second in 2011 and third in the 2015 vote. She also tried to win an at-large seat on Thunder Bay Council in 2018. The Ontario PCs in Thunder Bay Atikokan are planning to hold a virtual nomination meeting on Wednesday night, and Kamuzi has been chosen to carry the party banner. She'll take on the NDP's Judith Monteith-Farrell and still to be named candidates for the Liberals and Greens. The next provincial election is currently slated for June of 2022. With warmer weather expected to continue this week, Thunder Bay's cross-country ski areas are facing a potential early end to their skiing season. Catalina Gillies has more.
This year's cross-country ski season is nearing the finish line due to the recent rise in temperatures. The snow has begun to melt, making fewer trails open and safe for skiers. Dave Setti, manager of the Camview Nordic Center, says he hopes to stay open for another week.
Right now, what I have opened, things are looking pretty good. All the trails I have opened and groomed right now are showing signs of spring. There's bare spots, there's icy spots, but what is open is still looking pretty good.
This winter activity has become even more popular this year during the pandemic. Setti says more memberships have been sold than in previous years. Tuya Puris, owner and operator of the Lape Ski Center, says they've also seen growth of the sport.
It's been a good year, and there has been an increase in new first-time skiers, which I really find very encouraging, that people have found something nice to do and being able to be outside and exercise. We are still good to go for a little bit, so the membership is very happy to be able to continue skiing, and we do groom when the nights are cold, so the next day is always nice sugary conditions.
With daily highs in the plus temperatures all week and reaching as high as 8 degrees on Wednesday, it may be your last chance to hit the trails one more time this season. Catalina Gillies, TBT News.
Running out of